So many people in the tri-state want to find answers to end the epidemic. It is something we're giving time to tonight during this newscast. I am joined now by three people who are on the front lines of fighting the epidemic. Dorothy McIntosh Shoemake, who lost a daughter to heroin, Jim Biding, the Chief Executive Officer of Transitions, and Denise Driehaus, the Chair of the Hamilton County Heroin Coalition. I want to thank you all for being here.
Thank you.
President Trump today said that we can win the war against heroin. Do you agree?
Only if we do it together. Only if we have a collective effort where it's prevention, treatment, law enforcement, public health, hospitals, faith community. We have to do it together, and we have to have the resources to address the need for treatment.
He said we needed to bolster law enforcement, and he also said we needed a kind of just say no approach with young people. Is that enough?
I think those are two elements of it. I think there's a lot more to it than just those two things, but those are two elements. But I absolutely feel we can win this war on opiates, absolutely.
Okay, why?
Well, I think we have a lot of good progress right now, and I think sometimes that goes without, people don't kind of focus on that. But there's a lot of people in recovery. There's a lot of good treatment going on. There's a lot of good work being done by the county and by a lot of strong advocates as well. Mm-hmm. So there's a lot of success out there.
You work with treatment in northern Kentucky.
I do, yep.
So you see it firsthand.
We do, yep,
okay.
We do.
And Dorothy, you're a mom.
Yes.
You lost your daughter Allison in this fight.
Yes.
So the fact that the president is being very public, it was a campaign promise, is that important to you?
It's important to me that it's followed through on, yes. I hope we see actions taken.
This was your Allison?
Yes. She was 18 when she died from a heroin overdose, and it'll be 2 years this month since we lost her.
I'm sorry for your loss. The president has been talking about fighting the opioid crisis. There is a preliminary report out there that also calls for expanded access to drug treatment for Medicaid recipients and increased use of medication-assisted treatments. Would those things be helpful, and why?
Oh, absolutely. The medication-assisted treatment, medication's a key component to treatment. There's brain chemistry that needs to be righted. And
are we talking Vivitrol?
We're talking more Suboxone, Methadone. Vivitrol is also, and they're more Suboxone and Methadone kind of medications. Those are very important and can really help the brain chemistry and really jumpstart recovery. Medicaid paying for treatment is extremely important as well. It's one thing to have beds available, but it's another thing to get those paid for, and Medicaid's extremely important. So,
what have we found in Hamilton County? Is it a problem finding affordable treatment?
Well, I think we need access to treatment, whether or not that is the actual facility or the ability to pay or have the insurance or the Medicaid. We just need access. And so the treatment piece is so important. So is the detox piece, and so is the support piece. So you've got like these three legs to the stool, and treatment's right smack in the middle. And you have to have all three of those and ongoing support to make sure that this person stays in recovery.
Sure. You walked the walk with your daughter. Would 30 days have been enough?
It wasn't, no.
Okay.
We also had trouble because it was not dual diagnosis treatment. And now providers are starting to include both mental health and substance use disorder treatment for both of those together.
And is that the key? Recognizing that this is a disease and not something that necessarily is a choice?
Absolutely.
Okay.
It's a key to change minds. It's a key to bring down resources. It's a key to treat people with dignity who are trying to get through recovery. It's absolutely imperative that we understand that this is a disease.
Okay, we have about a minute left. Final thoughts.
Well, I think great comments about the disease, and I think the key is to individualize the care as well. And if 30 days isn't enough, then we need to provide 60 or 90 or 180.
6 months, whatever.
6 months or a year, and everybody's different. So we have to treat people with dignity and respect and treat them individually, because everybody's different, everybody needs a little something. And we need to do a better job, I think, from a treatment community and involving family in this process as well. So,
Dorothy, what's at stake if we don't tackle this problem?
Families are losing their children or their parents, loved ones. It's killing off a generation. And all family members are affected when somebody is suffering from addiction. The cost is far too great to not do something.
All right. Nan, on your side, pledges to continue to cover this issue. We really appreciate the fact that you joined us tonight to talk more about what's happening at the federal level and then, of course, seeing how that plays out at the local level. And we hope to continue the conversation at a later time.
Thank you.
Thank you.
Thanks
Thank you.
for being
Thanks.
here. As we said, Nine on Your Side is committed to covering the heroin epidemic and how it impacts you. You can find all of our reports right now on WCPO.com/heroin. We have also posted resources for anyone who is looking for help.